thinking beyond mandates and the long-term goals. I'll continue with Manju since you talked about this great analogy, right? I mean, we're continuing on the path of implementation and just closing it out, right? We know that these are going to be a little large and complex integration efforts that we're talking about, right? So, how do you think the role of program management, the overall healthcare system integration efforts would be perceived from an LTI standpoint? Could you please elaborate on that one?
Yeah, those are. I think you brought up two of the probably some of the most important aspects of these implementations, right? And I think what we've seen is lack of these two is probably one of the key reasons why these programs fail as well. And we've seen it with customers. We've had customers come back, and they some of them tried things with not a great program management and not a good integration approach and so on. The program's failing and then coming back and restarting everything with us. So we've had examples like that. So I think these. I think all of us have already talked in different terms here about how complex these implementations are, right? So complex implementations need a very, very strong program management, right? And it's not just about having following strong program management principles, but this has to be built specifically for initiatives like this, right? It should be built on the compliance initiatives we're talking about, right? So it has some of those unique things that we need to bring in along with the program management principles. I think that's going to be very, very important, and I think it's important to work with a partner that has experience running these complex initiatives, have seen what fails programs and how to adjust that and build some frameworks on top of that. So I think that's basically what we bring to the table. And I already talked about the largest fire implementation initiative. These are great case studies for us to go back and look at and make sure some things don't happen again, right? So I think that's those are very, very important things that you brought up, Nitin, and very important to keep those in mind for these initiatives.
Glad if all the health plans were listening, please be aware that PMO and the governance is going to be the key as far as these implementations are concerned, not take it with tactical. So I have a couple of questions at the end, and probably wanted to get Tony's view on that. How should health plans take these beyond mandates, right? I mean, how can they leverage these implementations and opportunities to think from just a long-term perspective? Well, yes, mandates are important; they can have their check boxes tick, but from a long-term perspective, how should they perceive this one?
Yeah, part of the way the government moves the healthcare system is through mandates and carrots. So the carrot and stick approach, focusing on moving incrementally towards longer-term goals. So part of what we see here today, and we've heard about this in the news as well, is the health plans are not regarded very highly by their members. There's complaints about a lack of transparency, a lack of understanding how decisions are made. And we saw, the tragedy a few months ago of a healthcare executive getting killed, and the resulting outcry was about the health insurance plans, unfortunately. But I think it brought up a larger picture about the issues around transparency and around getting decisions made. So when we start to look at what this does, the fire implementation and this particular regulation, they build a platform of efficiency, decision-making, and flexibility that begins with some of the government-mandated programs, but then can expand to the commercial side of business, not only in prior authorization, but in other business processes as well. So not only does that provide better business for the health plans, but it also helps them in terms of their working with their membership. Now they get the members say, okay, maybe they don't need as many prior authorizations decisions, or if a prior authorization is needed, it gets done much more quickly. And all of a sudden you start changing that dynamic that then begins to build on the patient APIs and some of the other areas that the two regulations have done over the past number of years. So to me, it's not what we're doing today in setting up the infrastructure, the platform, and the thinking, but it's how we take that to the next level to build better relationships between players, between payers and providers, and between payers and members.
I think you touched a very key point. Again, I just wanted to understand maybe from Mark as well, right? I mean, what is his take on these long-term value from these mandates? And he did touch upon some of the fact that, how Onyx is looking into implementing some of these into their platform capabilities. But yeah, Mark, your thoughts?
Yeah, I mean, Tony made some great points there. Let me maybe put some flesh on that with some examples. If people are complaining about prior authorizations and lack of transparency, and it's delaying getting treatment, there's stats out there that say, if a patient goes in and you're waiting for a prior auth, they leave the office, about 50% never come back to complete the treatment, right? That's not unusual, right? So what will prior auth and these standardized APIs potentially do? Well, what we've seen in actual testing, with real production scenarios, is that you can see a reduction in the number of prior auths being submitted by a factor of 40 to 60%, because many providers put in a prior auth just in case. Well, that means A, they have to put that together, and B, the payer has to respond to it. Well, what happens if instead these prior auths are designed to fit into the provider's workflow, and if they get a response back in 15 seconds saying, no, you don't need a prior auth, go ahead, they can now immediately book the patient in for that treatment, right? Massive potential implications there. We've seen providers going from being able to process 5 prior auths in an hour to 15 to 16. And if you think about it, that reduction of 50% coming into the payer, they've got more time to process the prior auths they are receiving and can potentially turn them around much more quickly, with potentially, fewer people having to put eyes on them. All of these things start to come. And that's why many of the plans are not coming to us and saying, hey, I've got to do this for my Medicare Advantage plans. They're saying, yeah, okay, I've got to do that for my Medicare Advantage plans, but what's it going to take to implement this across my business?
Exactly.
Yep.
I think we've touched upon some really, really crucial points. I mean, while we understand that the operational efficiencies and everything would be gained, but any delays in treatment will have an impact to the health, and we cannot put a cost to that particular aspects, right? And that is something that everyone has to understand in this ecosystem, the importance beyond cost as well, right? And how we can further ensure that the experience and the health of the members are taken care. I think, thank you so much for this wonderful, wonderful panel. I couldn't have asked for more from these 3 gentlemen to be part of this discussions. I hope our audience finds this to be informative, insightful, and valuable overall. And I'm sure that these Marvel stars of Mindtree and Onyx are there to deliver to the capabilities of the health plans. So thank you so much, gentlemen. Thank you so much. Take care.
Thank you.
Thank you.
Thank you, Mark and Thomas.